Good morning, Karen.
Hi, Isabelle.
Happy to have you here.
It's great to be with you.
Thank you. So today we're going to speak about risk in the pharmaceutical industry. So this industry is a very important one. It is a contributor to the advancements of healthcare and to economic growth. But it is also facing important challenges. You have a long experience in this industry, Karen, because you have been in a big pharma for many years as a group general counsel. You now are a non-executive board member in 3 companies. You also serve in 3 audit committees. So Karen, would you share with us your vision of risk in the pharmaceutical industry?
Well, the pharmaceutical industry is fraught with risk, as you know, and the risks range from regulatory, legal, patents, cyber, financial, reputational. But I think the most important one is patient safety throughout the lifetime of developing and commercializing a drug. It's one of the reasons why pharma is so highly regulated the world over. And it's important to recognize that if you're risk adverse, pharma may not be the industry for you. But when you consider the rewards, treating, preventing, and sometimes even curing diseases, the outcome is fabulous. But you can't be reckless in the pursuit of the outcome.
And how does working in such a risky industry impact your day-to-day activity? And who are those concerned by managing risk?
Well, I think all employees in a pharma company should be concerned by risks and the various kinds of risks. But clearly there are certain departments that are, I would say, directly involved, notably development, medical, pharmacovigilance, and of course, industrial affairs. And when a crisis arrives, I think it's most important these key disciplines work together because you need their expertise, they have constraints, and they need to work together because a decision that one of them make can impact the outcome of the situation. Also, pharmacovigilance and medical have to work together before they propose a change in the product insert.
And along the life of a product, Karen, meaning from development through commercialization, there are many opportunities for risk to arise. How do you know that, and when do you know that an event could turn into a crisis?
Isabel, we've both been in the pharmaceutical industry for a long time. So I think we've seen it can happen in development, it can happen in commercialization. I think you have to be aware of risks all the time. But I would say there are some that you're more inclined to have a big problem, i.e. product contamination, withdrawal of a product. A regulatory in some country can say, okay, we no longer think that drug is risk-benefit is appropriate. And then you can also have inappropriate promotional practices. And any one of them can turn into a crisis if they're not properly managed.
In the event of a crisis, Karen, what is the role of a...
First, you don't know you're in a crisis. So when there is an accident, when there's an event, if it's obvious, you pick up, follow the SOP, create the alert team. But many times you don't know. So I think what's important in the industry is be aware, connect the dots. When something happens that is unexpected, don't presume it's a crisis, but don't assume it is not. I think you have to remain very, very vigilant.
What is the best profile for a risk manager or a crisis manager, Karen?
Well, I think we have to make a distinction because risk management and crisis management are not the same. A risk manager is working on identifying and putting in place mitigation, detection systems, whereas a crisis manager has an event that has happened and they're reacting to that event, which may or may not have been identified as a true crisis. So I think the first thing to do is to make an assessment of the situation, pull together the various disciplines you need in a transversal working group. I think it's also important to make an assessment and then start knowing that you'll have to make decisions without complete information.
What are the respective benefits of appointing an internal employee versus appointing an external consultant?
I think it very much depends on the company. I think most large pharma companies, because they're resourced appropriately or sufficiently, they would probably have a risk management department, people who have that as part of their job, and then they would probably pick someone of them, depending on the nature of the crisis, to lead it. I think in small or mid-sized companies, it's a little bit different because they're not resourced the same way. And they would probably consider outsourcing risk management because that isn't their core competency.
Mm-hmm.
And when a crisis arrives, it may be in their interest to bring somebody in who's had experience in a crisis, because the internal teams are already stretched thin. They won't have the time to devote to the crisis. And in addition, there's some benefit of having independent, I would say, calm person leading it to give a good assessment without the emotion and the crisis that by definition happens when there is something unexpected, that the future of the company is at risk.
Absolutely. You can never be fully prepared in case of a crisis, because we are evolving in such a complex and uncertain environment. You should rather be ready to face the uncertainty and identify in advance profile of agile leaders.
Absolutely. I think a crisis manager has to be, first of all, good at project management. They need to be calm under pressure.
Mm-hmm.
They have to have good communication skills, but also good listening skills, because ultimately you have to value teamwork and ensure that people are appropriately informed, communication internally, externally. And I would say, in addition to being calm under pressure, have great emotional intelligence and empathy.
Thank you very much, Karen.
It was a pleasure.